Well, welcome to this video where we're carrying on our thinking about the nature of infectious disease and how disease is transmitted from person to person, the nature of infection. And there's a bit of terminology and a few basic principles we need to look out first so we can understand what's going on here. Now, the first term I want to talk about is a vector. Now, a vector is any living organism which transmits disease between organisms. So, for example, ticks can spread Lyme disease, called borreliosis, to humans, quite a nasty disease in humans. It's well known that mosquitoes can spread malaria. Mosquitoes can also spread another viral disease called dengue. Not that malaria is a viral disease, it's not, it's a parasitic disease. But dengue is a viral disease spread by mosquitoes, and that can be a hemorrhagic fever. It can cause bleeding. Or dogs, rabid dogs could spread rabies. So a vector is any organism that spreads disease. Or if you spread disease, you're an organism. If you spread disease on your dirty hands to someone else, then you would be a vector. Now, a fomite, on the other hand, is an inanimate object which spreads disease. An article which spreads infection between hosts. So the host is the person that has the infection. So classic fomites are in hospital all the time. Sheets, skin cells from the dust, hair, bits of clothing, ties. Doctors' ties used to dangle down. And in the old days, we used to wear long sleeve white coats. This is a grey one, but we had long sleeve white coats which could infect your patients. So now the policy is bare below the elbow. So at work, we're always bare below the elbow, so there's no clothes to act as fomites causing infection. Pens, doctors' stethoscopes are classic. Now, I remember we used to have a blood gas machine on intensive care. We only had one in the hospital. There was one in the path lab, but we weren't allowed to use that. And people used to come from A&E, and they used to come from the surgical wards, and they used to come from the medical wards, and they'd all use our blood gas machine. And we found out that that was spreading disease. So people would come from the surgical ward and put some of their bugs on it. Then someone would come from the medical ward and take the bugs back to the medical ward. So it was acting as a fomite. It took a while to work out where the infections were coming from, but it was the blood gas machine being a fomite. Pens are an absolutely classic one in hospital because pens get shared around and all sorts of bugs can stick to them. Now, cross-infection is transfer from one person to another. That's all it is, transfer of infectious organisms, viral particles, bacteria, fungal infections from one person to another. It's cross-infection. So this could be dirty instruments. If the instruments aren't properly cleaned and sterilised, it could be coughing, or it could be touching someone else and infecting someone else, probably from me or from the patient in the bed next door. It could be from contaminated bedding. It could be from dirty hands. And the whole field of infection control is to prevent cross-infection. That's why we have infection control systems, to monitor exactly this and prevent cross-infection. Now, exogenous infection is when infection arrives from outside the person. So here we have our person. Now, if there's exogenous infection is infecting the person from outside. It's coming from somewhere else outside. Could be from an outside person, could be from an outside object, and that is causing infection in the person from the external environment. And of course, this can happen quite commonly. But the other form, endogenous infection, is from within or on the individual. So, for example, an individual may have a wound here, and then they start scratching at it with their dirty hands. So the infection is going from their hands to their wound. It's from within the person, it's endogenous. Or it may go from the anus of the person into their urinary bladder, or from the mouth onto the skin into a wound. They're becoming infected with their own normally bacterial infections. So exogenous from without, endogenous from within the person. And of course, people are notoriously unhygienic in both ways. So we get endogenous and exogenous infection, both quite commonly. Now, next, it's useful to think about vertical and horizontal transmission. So vertical, of course, means up and down the way. Horizontal means side to side that way. So if we think about horizontal transmission first, that's between two people that are living and they are not father and son or mother and son or mother and daughter. They are just happen to share the planet at the same time. So the infection can go that way or it can go that way. It's horizontal between individuals that are standing up. It's horizontal going that way. But the converse of that is vertical infection, up and down the way. Well, down the way really. So here we have mum, and vertical transmission is when infection goes from mother to her child. Now this could be the unborn baby. There could be an interuterine vertical transmission, or it can be perinatal, occurring just before or during the process or just after birth. So when mother gives birth, there's often mixing of maternal and fetal blood, or there can be transfer of infection across the placenta, transplacental, but they're both vertical because they're going from mother to her child. Whereas with the horizontal, it's not mother to child, it's to two people that are equally on the same level. That would be horizontal transmission. Now, let's think about some examples. First of all, of vertical transmission, which is from mother to child. So Toxoplasmosis, for example, it's actually a complicated cell toxoplasmosis. It's what we call a eukaryotic single cell. It's not a bacterium. And this can be transmitted classically in cat feces. This is why pregnant mums aren't allowed to take out the cat litter. And it can also be transmitted in poorly cooked meat. But animal feces, particularly cat feces, is the most common one. And it can cause miscarriages, stillbirths and brain damage in babies and eye problems. So toxoplasmosis is a really nasty one actually for unborn babies. Now, rubella is German measles. So this can cause miscarriages. It can cause damage to the baby as well if the mother catches German measles during pregnancy. Now, herpes simplex virus type 2 can be transmitted during the process of birth from the mother to the baby. Now, Zika is a virus. You might have heard this of a couple of years ago. There was quite a big outbreak in South America. And the Zika virus went from the mother to the baby, and it adversely affected the development of the baby's head. So the babies were born with small heads, microcephalic birth defects. HIV, I think everyone knows about, human immunodeficiency virus. That is what causes AIDS, the acquired immune deficiency syndrome, and that can go from mother to baby, and the baby can be born with it. Syphilis is a well-known vertical transmission condition, sometimes called congenital. It's present at birth. It's a bacteria, of course, often sexually transmitted. And hepatitis B is another one. Hepatitis B virus can be a vertical transmission. Whereas horizontal transmission is one member of a species from another. So one member of a species to another member of the species, of the same species, but they're not mother and child. And in horizontal transmission, the infection may be directly from one person, so directly from me to you or from you to me, or it could go via the environment as well. So with influenza, for example, someone can cough and sneeze on a surface, I can touch the surface, and that can go into my mouth or my eyes and cause infection. Now, spillover infection, or pathogen spillover is another way to say it, or spillover event is another way to say it. Here the pathogen moves from a reservoir population. Now, a reservoir population is a population where the infection, whatever it is endemic. It's always in that population. But it moves from the reservoir population into a novel host population. And the thing about the novel population is the novel population has not come across this particular pathogen before, so will have no immunity to it. So this could be, for example, the terrible situation that happened in the Americas, where Europeans first went to the Americas and millions, tens of millions of people died of smallpox because they had no resistance to the smallpox virus. But very often when we're talking about spillover, we're talking about the zoonoses, which is another modality of disease spread. Now, zoonoses is any disease that comes from an animal. So, for example, nearly all viral infections that humans suffer from are zoonotic. Some are derived from animals recently, such as influenza or HIV, are both zoonotic. Or others have been with humans for maybe thousands of years, but originally probably came from animals. So most viral infections in humans, probably 2/3 of them actually are zoonotic viral infections at one time or another. So the zoonoses is when infection goes from animals to humans, a pathogen, whether it's a bacteria or a virus or a fungus. Usually it will be a bacteria or a virus, goes from animals into humans. So rabies, for example, can come from infected dogs or bats if dogs are rabid. Bats can carry rabies as well. It's a virus. Yellow fever, that's a hemorrhagic fever, yellow fever. It comes from monkeys via mosquitoes. It's vectored from monkeys to humans via mosquitoes. Leptospirosis comes from rats. It's a bacterial infection, sometimes called Wheels disease, and that can cause bleeding and yellow discoloration, jaundice, and renal problems. Quite a nasty bacterial disease, leptospirosis. Now, you might have remember a few years ago there was a lot of talk about what was called mad cow disease, and this is a spongiform encephalopathy. Spongiform means like a sponge, spongy. Form, the form is like a sponge. N is inside. Ceph is brain. Pathology is disease of. So the brain, there's a disease in the brain which makes it go spongy. Spongiform encephalopathy. And that's spread by something called prions, which stands for proteinaceous infectious particles. They're not bacteria, they're not viruses, they're actually infectious proteins. Quite unusual, but that's what causes spongiform encephalopathy from cows. And influenza type A, comes from poultry. Influenza can be A or B. The A's often come from animals. That's the most common source of seasonal flu. And the influenza B is normally from a human reservoir, but the A is more common. Both RNA viruses, ribonucleic acid viruses. Now, another group of infections is what we call healthcare acquired infections. And of course, in healthcare, we're very conscious of healthcare acquired infections. Now, healthcare acquired infections are any infection acquired in hospital or as a result of healthcare interventions. So if doctors or nurses cause infection, that's a healthcare acquired infection. If you go into a hospital and you catch a disease in the hospital, that's a healthcare acquired infection. Or if my dirty instruments or my dirty needle causes an infection in you, that's a healthcare acquired infection. The converse of healthcare acquired infection is community acquired infection. So that's acquired in hospital related to healthcare. That's caught in the community from other non-healthcare professionals who happen to live in the community. Community acquired infections. Now, the old-fashioned name that's still often used quite a lot for healthcare-acquired infection is nosocomial. So if you see this word nosocomial, it just means HCI, healthcare-acquired infection. It's just another name for it. So contracted in hospital from healthcare interventions, from dirty needles, from dirty instruments, from the patient in the bed next door, anything like that. Because in hospital, patients are often in close proximity. Now, old-fashioned hospitals used to be able to open all the windows, but now the windows tend to be sealed in case people fall out of them. So hospitals can actually be quite stuffy places now, and often the beds are too close together. So we've got a lot of sick people in close proximity. Not ideal at all, really. And then staff, we go around from patient to patient, taking your blood pressure and giving you cups of tea and making your bed and doing things like that. So we're going around transmitting disease in the hospital. And as well as that, in the hospital, we use a lot of antibiotics. Now, the thing about antibiotics is they kill the natural flora of the body. So they kill the natural flora in the colon. That can give you diarrhea. They kill the natural flora in the mouth and the vagina, which can be colonised by fungal infections causing thrush. These fungal infections that you get in the mouth and the vagina are quite unpleasant infections. And these are more likely to occur if we use antibiotics. Now, thinking about healthcare-acquired infections, these nosocomial infections, they can be bacterial. So, for example, Clostridium difficile, C. diff, Clostridium difficiles, is much more common in patients that have had a lot of antibiotics. And that is a bacterial infection of the colon that gives rise to a particular nasty form of diarrhea. Or there's another form of bacteria we get in hospitals called Methicillin-Resistant Staphylococcus aureus. And this is, Staphylococcus aureus is a type of bacteria, and it's normally resistant to a drug called flucloxacillin. Now, I know that says methicillin because that was the original drug that it was resistant to, but it means it's the Staphylococcus aureus that can't be treated with the normal antibiotics. Now, coccus means that the bacteria is round. That's all coccus means. And staph means it occurs in clusters. So staphylococcus just means round bacteria that occurs in clusters. That's all it means. And aureus is a type of round bacteria that occurs in clusters. Patients in hospital can often get pneumonia. Very often when patients are immobile, they're more prone to pneumonia. In fact, we used to call this hypostatic pneumonia. Pneumonia patients get because they're static and immobile in hospital, particularly a risk if the patients are lying flat. That's why we never leave patients lying flat unless we absolutely have to. We always prop them up. But there can be viral infections spread in hospitals as well. I know I've caught a few of them. A nasty one is viral hepatitis. So hepatitis can be A, B, C, D or E. Now, A is normally infectious and E is normally infectious. But B and C are serum, that they're transmitted in blood and body fluids. Now, this is why intravenous drug users, what we call IVDUs, everything's abbreviated in hospitals, IVDUs, intravenous drug users, can get infection if they share needles of hepatitis B and hepatitis C. It's very common. HIV can be spread in the same way by dirty needles and contaminated equipment. And there's been absolutely tragic cases where needles have been reused by people that call themselves professional healthcare providers, doctors and nurses, and to save money. I've seen this happen, and I've seen needles reused. I always don't tolerate it, but I've seen people trying to do it in poorer parts of the world where needles are reused, and it's just really too dangerous. And that has caused many cases of human immunodeficiency virus infection causing acquired immune deficiency syndrome and viral hepatitis, quite inexcusable. Influenza can be transmitted in hospitals. I know I've caught that in hospital as well. Tuberculosis can, although that's less common these days. Now, phlebitis is that's a bacterium as well. Phlebitis is itis is inflammation of, and phlebitis is inflammation of the veins. And this often happens because in hospitals we're always sticking needles and cannulas in veins to take blood or to give intravenous fluids. Normally this happens when a cannula is left in for a period of time, or it's inserted using bad technique. And you get inflammation of the vein, and you have to take the cannula out, send it for culture, and replace it in a different site. Urinary tract infections often ascend up, especially as we catheterise patients. This is why we only catheterise patients now if we absolutely have to, because it causes urinary tract infections. And urinary tract infections, of course, can spread up to the kidneys, causing pyelonephritis, which you don't want to have. Pneumonia can be transmitted. We call it hospital-acquired pneumonia, actually. Hospital-acquired pneumonia, HAP, as opposed to community-acquired pneumonia, CAP. So pneumonia in hospitals. Norovirus, I got this winter before last as well, working in A&E. Norovirus, sometimes called the winter vomiting bug, and it gives you the most appalling watery diarrhoea. At least it did in my case, and I didn't vomit with it though. Some people vomit with it, but this appalling watery diarrhoea that lasts for a couple of days, and then you just feel pretty rough for about the next 10 days after that. At least I did. Now, also thinking about these nosocomial hospital-acquired infections, surgical site infections, if infection gets into a surgical wound. And we looked at this can be exogenous from outside, so I could give it to a patient from my dirty hands, or the patient could get it from themselves, perhaps from their feces onto their dirty hands, causing infection themselves. So endogenous would be from the patient themselves. Exogenous would be from outside the patient through my poor interventions or via dirty instruments or dirty dressings or something like that. So for hospital-acquired infections, we always have to remember the prime directive in healthcare goes back to the days of Hippocrates in ancient Greece. First, do no harm. And as Florence Nightingale said, the hospital must do the patient no harm. If we don't help our patients, that's one thing. But if we actually make it worse, that's as bad as it gets in healthcare. If we get someone healthy and cause a disease in them, it really doesn't get any worse than that. That's the worst thing you can do as a healthcare provider. So the converse of hospital-acquired infection is community-acquired infection. Now, community-acquired infection, we mentioned community-acquired pneumonia. And it's good to know about because it tends to be caused by particular bacteria, and you can have a fairly good guess at which antibiotic is most appropriate if you know where the patient contracted the pneumonia. Rhinoviruses cause the common cold, get 2 or 3 of these a year. Influenza, as we've said, can be A or B. A normally comes from animals, and A is the one that tends to occur in infectious outbreaks that can cause pandemics. So you might have heard, for example, of H1N1. That's influenza A. Maybe, I don't know, 75%, I would say, of winter flu is type A. B is about 25% of cases. And that tends to come from a human reservoir. Community-acquired respiratory infections are virtually universal. Now, upper respiratory infections, we would normally say this is an infection in the upper airway above the level of the epiglottis, that bit that flaps down over your trachea, to stop you from choking. So nasal passages, oral passages, nasopharynx, that tube at the back of your mouth, oropharynx, laryngopharynx, they'd be UTRIs. These appalling abbreviations. UTRIs, upper respiratory tract infection. Whereas lower respiratory tract infection with the bronchial passages, bronchitis would be lower tract, or infection in the lung tissue itself, which would be pneumonia. Now, measles is a viral infection, very infectious condition. Infective parotitis is mumps. It's a virus. It affects the salivary glands. It's passed by droplet infection. And the parotid salivary glands are just here. Infective parotitis affecting the parotid salivary glands. And kids get this especially in the kind of bunch out that look like hamsters who are carrying food in their pouches. Rubella is German measles. It can cause it's a viral infection, can cause a rash. And if mother catches it in pregnancy, it can cause cardiac problems, cerebral brain problems, eye problems, deafness. Not one to catch in pregnancy. Chicken pox is caused by the varicella virus, the varicella zoster virus. And the chicken pox virus, this varicella virus, the zoster virus, varicella zoster in chicken pox, can come back and cause a herpes zoster. And this is the skin rashes. So this virus, this chickenpox virus, you can get an acute infection with it causing chickenpox. Then that goes away. But what the virus does is it actually hides in the cell bodies of the sensory nerves near the spinal cord. And it can stay there for decades, and then it comes back when you're immunosuppressed, affects that nerve root, causing these, can be often stripes, or occurs in areas of the body that are consistent with the spinal nerves, and can cause this rash which is itchy and can be excruciatingly painful. So it's the same virus causes chicken pox as shingles. Sexually transmitted infections are community acquired, hopefully not hospital acquired. Now, take your pick: HIV, chlamydia, gonorrhea, syphilis, pelvic inflammatory disease, genital warts, human papillomavirus. That's a subject in its own right. And in the old world, we still get outbreaks of pneumonic plague. Pneumonic plague is plague in the lungs. Bubonic plague is plague in the body. And this is caused by the bacteria called Yersinia pestis. And this is what caused the original Black Death in my country in 1348. And we know for sure that this Black Death was caused by the Yersinia pestis bacteria causing plague, because we've taken graves and human remains from these outbreaks. There was outbreaks all over the time. The last big outbreak, I think, was 1665 in my country, was the last big one. And we know from looking at bodies, the Yersinia pestis bacterial genetic material has been found in the body, so we know it's caused by that. Pneumonic plague is the pulmonary form of the same bacteria, and there still is some outbreaks of that. There was one in India a few years ago, actually. Smallpox, thankfully, has been eradicated. That used to be a complete scourge on the world. It was a community-acquired infection. It was eradicated through excellent vaccination and containment programs. Although stocks are retained in certain laboratories around the world. Let's hope they never get out, because we've lost our resistance to it. So that's community-acquired infection as opposed to hospital-acquired infection. So that's just a few of the principles of infectious disease to carry on our thinking about the nature of infection.